go ahead and sit down over here. So how long can you go without a neck brace?
That's a good question.
Depends on what she's doing. Yeah. She's at home. When she's reclining on the couch, she doesn't wear it generally.
If I'm
But if she's up and about,
walking around and I don't wear it, I guess it depends on how severe I expect if I want to let my symptoms become. If my intention is that I would not have trouble breathing or speaking, I need to make a conscious effort to keep my head up and my neck as straight as I can keep it, which takes a lot of work. And
so you would have to make it straight as in
I would try to do this.
Okay.
And that takes a lot of work. It's painful and it takes a lot of work. My hope is that it will make it so I can continue functioning. Going upstairs to the bedroom and getting whatever I need to get and then make it back downstairs without feeling like I'm going to lose my balance, like I'll feel like I'm going to fall backward.
That happens just randomly.
It's like...
That's a spasm.
Yeah, it's more like that.
The
She's not wearing her
spasms.
brace.
And even right now, I was fine. I was moving 3 times as fast as I was previously because I was laying down. And just right now, my neck, I'm trying to keep it as straight as I can. My arms are hurting more. My back is hurting more. My head is hurting more, and I'm starting to twist and have trouble talking. So I wear it most of the time. I really don't risk it if I want to make sure I can get my son from school.
Okay. And when your body hurts like this, it goes all the way down to your feet too, right?
Well, I mean,
Everything gets weak and locked up. You kind of see the extent of the locking up if it's just isolated to your like the upper extremity, or is it actually your whole
The
body?
entire body.
my whole.
Yeah.
And what'll happen if I don't wear the neck brace is I can feel the muscles in my neck tensing more and more, and it feels like they're popping out because they're like trying their hardest to stabilize me.
Okay.
Even with my neck brace on, that'll happen.
Okay. When your body, like that locking up episode that you're talking about, that locking up is usually with twisting motions, right?
That day, we're not sure that she did any particular motion to activate that, but...
The night before I had washed my hair and I had flipped my head upside down.
Yeah, she talked about that as a possible trigger.
And I think I've been doing that for years, but I think it was kind of like the straw that broke the camel's back.
Yeah.
Like my body's just like, all right,
So that was the
I'm
night
not
before.
interested in you doing that anymore.
Now you can see the symptoms are much quicker onset. Can be almost instantaneous
Okay.
if she moves her head in a certain way.
Okay. It's usually looking down that's really bad.
Yeah.
right?
Normally, that's the quickest response.
It's looking down.
Yeah, but twisting, looking up can also affect her. But maybe not as instantaneous.
Okay. You don't remember what the MRI showed or anything?
I didn't view them.
Yeah, we haven't seen a lot of the details ourselves. The MRI basically said there was no significant abnormalities. And the MRI mostly looks at the disc structure or looks for nerve impingements.
Yeah.
So no red flags there. No nerve impingements, disc health or whatever. Nothing was flagged as a significant issue.
Yeah, no significant.
So they basically, the bigger diagnosis that they were basically thinking were like epilepsy, fibromyalgia,
Some kind of degenerative disease.
MS, everything,
Like as in MS, degenerative?
That's why they did the brain MRI initially, I imagine.
Okay. So, yeah, because you got the EEG done.
Yeah.
Nothing there.
Right.
Yeah, a lot of other things. I
Yeah,
forgot.
nerve
Right?
conduction.
You got the NCV. Did
EMGs.
the NCV show anything?
Nope.
Okay.
No.
EMG.
I don't have mad cow or ALS, so that's good.
They've just been
That's good.
eliminating the major ones.
Yeah, that's mostly what it's been, an
It's
elimination
really
of
weird.
really bad symptoms, diagnoses. I mean, that's why they kept on sending me elsewhere.
No definitive diagnosis.
Yeah.
When you got the flexion, you got a really bad reaction. What
Yeah.
happened at that point?
I put my head down, they took the picture, I put my head up, they took the picture, and then I started to feel a little stiff,
They had her seated.
and they got my neck brace and my glasses, and I went over and I started to put the neck brace on. I was very slow, and I said, "Could you get my husband?" And he came in, and then I was just having a lot of trouble
Yeah, she's moving super slow.
and I was able to shuffle my feet, but my hands were stuck in this position, and I couldn't get them to relax. And now my hands are in this, stuck, and my whole body is
Getting
like
rigid.
trying to
So her arms are getting more.
trying to stabilize my body, and it's failing.
Okay. When it does, is that typically what happens?
Yeah,
It starts-
I usually move her hands down and just have her relax. Of course, she's not going to be able to relax sitting up like that. But
Yeah. Okay, so when she does lie down, when you do lie down, that's when you can recover, right?
yeah,
And meaning all this starts like dissipating,
it starts to dissipate.
and she's able to gain her strength back.
Right.
Her left ear is a lot higher than her right ear. A lot higher. Your breathing gets affected as you sit longer too.
If I
Breathing
lean,
is more labored.
if I lean forward even a slight bit, even sitting down, I'll have trouble breathing.
Okay.
Now my body's starting to shrink again.
Yeah. Well, that's starting to raise up again too. So, let's see. Sure.
I imagine my head's straight up and down, but it feels like I'm leaning to the left. I'm so used to leaning that way.
I noticed she can barely walk. Like, is that typical, or is that just after being upright for a long
That's
period?
symptomatic. That's when her symptoms are worse.
So it's been a little bit of time since you've been sitting there. How do you feel?
Okay, I can move my hands. I still feel unsteady.
Yeah.
My lower half of my body is starting to shake again.
The speech gets slurred too, right? And so, why do you feel like it kind of gets slurred? Is it just hard to force, or is it like the muscles get weak in your mouth, or?
That's a good question.
Or is it your breathing?
Yeah, or is it the breathing? There's a lot of things involved in speech, so I'm wondering, like.
Sure. They seem to be independent of each other. So sometimes I'll have problems breathing, but I won't necessarily have trouble speaking. Or I'll have trouble speaking, but I won't necessarily have trouble breathing.
Okay. Yeah, things are becoming very spastic. Yeah, I know we talked about ataxia, dystonia.
When she froze last year, she wasn't able to move any of her face
But I could still
or
speak.
her lips, but she was just kind of talking.
I
like
was
this.
talking like this.
Yeah.
So I could make the words,
But she could not move her
I couldn't do her.
facial
So you just went all
muscles.
paralyzed.
Yeah. And I can feel my head tilting to the right now.
Yeah.
And I'm having a difficult time.
You've been going through tests for like, how long? Like couple of years?
Years that it's been worse.
Okay.
But
Yeah.
before that,
Oh yeah, how long has all this been going on?
2014 was when I did a sleep study. It was at home. I had to sleep on my back, and that night I didn't sleep very well, but not poorly enough to have any sleep diagnoses. My legs that night started to hurt a lot.
Okay.
I realized I had pain all over my body later that year. It was September and October, and then within a few months I started having occasional trouble walking. And then I'd sit down to eat dinner or whatever, and then when I got up I was fine.
Yeah.
I think it all is migraine. That's what I think it all is. It's the only thing that makes any sense. I have to wear sunglasses when I'm outside in the sun all the time, even if it's just the tiniest bit bright, because if I don't, I will get worse symptoms. The
Smells, skunk.
all of that.
Yeah.
It basically, this is my migraine now, and it's like I'm having a perpetual migraine.
So really quick, when you did get just the migraines before, was it in the back of your head that you had it, or more in the front, or in the?
Kind of what Dr. Chris was saying. It's kind of a crown, sort of. Now I have continuous head pain. The head pain is more prominent in the back of my head.
And more prominent on this side or that side? Just in the back?
Yeah, and kind of like all the way around. And I was getting migraines when I was a little girl too, playing out in the sunshine. And I'd get a pain in the back of my head.
Okay.
So I didn't, apparently that was migraines.
So the sensitivity is food, the smells, and the light. It used to just be migraines, now it's like the whole body neurological symptoms. Okay, the spasticity and all that stuff too. Got it. The foods, really quick, is just the things that are more serotonin enhancing, or?
I don't know.
You know, I found out actually the foods that follow with the migraine diet do affect serotonin.
I do want to see how you're walking now that you're upright a little bit more. And I know this is going to test you a little bit more, but there's a specific reason why I'm doing this first.
Oh,
so
I
you can just walk to me. I don't know if you can really, and then Ruben, if you can catch this.
This is normally the speed when I get up in the morning.
That's your speed?
When I wake up in the morning.
Okay, you can just walk to me
and
to
then-
in a circle. So you're walking like that because of weakness, because of balance?
That's a good question. One, I know that if I walk faster, I'll have more neck and head pain.
So it's a protective.
That's one reason.
Okay.
Another reason is it takes a lot more effort to walk faster.
Okay.
I would have to force myself, and it's just not worth the effort that would be needed.
Whereas if you lie down, you feel like you can go 3 times faster. Right?
Yeah, if I lie down or I rest, then I can end up wearing the neck brace even better.
Just stay there. Just stay stable. Just sit down.
Now, like I said, if she's wearing the brace, it takes her longer to get to that state, but if she stays up even with the brace, she'll get to that state.
Got it. Okay. How much longer can she actually go with the neck brace?
With the neck brace, maybe, I don't know, that took like a minute or two.
Yeah.
Maybe with the neck brace, it would be more like, I don't know, 5 to 10 minutes, so maybe 4 times longer.
Okay. You look like you're recovering like a lot.
Yeah.
Right now. That's incredible.
Like I've been told it's psychological. I've been told that it's, I have to deal with something that happened in my past.
This is really interesting because you feel like you're recovering right here.
Yeah.
What's interesting is actually when you're lying down, your head was in a lot of flexion on that pillow.
Yeah.
Yeah.
And that's still completely fine.
Yeah.
So if it were true flexion, that would aggravate symptoms quite a bit too. Because it still stretches the spinal cord in that direction.
It doesn't feel good. It's not comfortable.
Yeah, but you're
I would
legitimately
prefer to lay without the pillow.
Yeah.
It feels better.
Yeah, that's way too high, but that's a lot of flexion, but you're able to walk.
I'm able to walk, I'm able to talk, I'm able to move.
Got it. Okay.
What I would prefer is to have flat
Yeah.
and have a pillow underneath my legs, because my legs, when they're lifted, my back goes down flat and then it feels more comfortable. So we have a couch like that at our church where I can put a pillow underneath my legs and I can lay there and I can reset.
Got it.
If I can't sit in the service anymore.
It also relaxes your spinal cord too. That's one of the big things too.
Yeah.
When you flex your knees, it relaxes your spinal cord too.
Oh yeah, that makes sense.
Yeah. So let's have you sit down here. I'm going to do a couple tests, and then I just want to test the working hypothesis, and then we can kind of get going from there. So obviously we saw that lying down helped too, no matter if you're in deep flexion or not, and positioning your head did too. So I'm going to do a couple things, right? And just be aware some things can aggravate it too, okay? But we could always lie down if it does. So the first thing I want to kind of do is go ahead and, you're starting to get in there, okay? So go ahead and tuck your chin in, and just tuck all the way back here. Any problems with that?
Okay.
No change in pain level?
How fast do you usually notice a change in pain level or symptoms?
I'm sorry?
How fast do you usually notice a change in symptoms? I should ask you this first. How fast do you notice things getting worse with like neck positioning or whatever?
It's so gradual, I don't even notice it until it's an issue.
Okay.
Because like when it comes to pain, I'm always in pain, so it doesn't really get to me until my ability to move is affected. Then I'm like, oh, well that wasn't very smart. So I'll have pain that comes up my left side of my, right here. And that's why I can't wear a hearing aid, because the pain will go into my ear if I'm wearing a hearing aid, and then I can't bear the pressure.
Got it.
And so I have hearing loss in this side.
Okay.
So if it's a sharp pain, I'm like, that startles me to, change my position. But just a dull ache. Like I didn't even notice until 2012, September of 2012, that I had a continuous headache. I was asked in the emergency room, because I went in there, they thought I was having a stroke, I was having migraine-associated vertigo. She's like, do you have a headache right now? I'm like, oh, yeah, I have a headache right now. I didn't even realize. I don't know how long I'd had a headache.
Okay, got it. You're starting to shake now.
Yeah.
Okay. So we're gonna do something. I'm gonna do something the opposite way. It's a lot worse. Okay, good. Let's measure you real quick. Just no matter how many times, just swings over on that side. Okay. A little bit here, but yeah, that's not good. That's tender. Just one more time. I'm gonna have you stand up for me, and then just walk around one more time. How do you feel right now?
Okay.
Okay. Still a little slow, but
Yeah.
I'm gonna do one more test just to make sure. Your first adjustment, I just want to make sure you're really good. So we're gonna go over to the right, and now it typically aggravates something.
Easier, a little easier, but it's still pretty. Like I can't really do.
I have more pain down my arms, but otherwise I'm not shaking.
Okay. We're gonna adjust the left occiput, okay? What I'm gonna have you do is tilt your chin up just a little bit. Just a little bit more. I'm gonna shift this down, okay? Just relax a little bit more. Good. Symptoms coming back again.
A little bit.
If you don't mind, let's walk around a little bit.
Sure. Well, it's less of a shuffling, more of a park feet, wider, more wider of a gait.
Okay, good.
I feel like I'm gonna fall that way. When
We
I
just
lift up
shu-
my foot,
We just shifted your head, so your gravity could take a little bit of
yeah,
time.
my gravity's off.
Yeah. Try relaxing your left shoulder. What I was trying to do, I was just trying to see if she could get more stamina, but just like reposition your head without like having to reset. How you doing there, Caryn?
Okay.
I'm wondering, as you're recovering there,
Pretty much stayed around like 42, 40.
that first adjustment, as you walked around a little bit, you said
Yeah, so this is
some
pretty
things
normal.
changed a little bit. What changed?
Too much elevation. So that's totally fine.
My
Now,
feet,
what I do want to show you
the
is
gait
this
was wider.
because
I
you got
could,
a lot
and
of good changes.
my feet were further apart,
So,
but my feet were also like, I could take bigger steps.
so
It felt comfortable to take bigger steps. It didn't feel like there was a lot of
this right over here,
effort
over
Okay.
involved.
leg is dropped.